Okay, so welcome. My name is Amanda Brown, and I am the school psychologist who did the evaluation on Minnie. Mom, I know I've met you, but Dad, it's nice to meet you. We're going to be going over the report, and it's a long report. It's a lot of information to take in. So if at any time I'm going too fast, or things don't make sense, or you're a little bit confused, please stop me. I'm more than happy to slow down, back up, and give you some more information or elaborate on any areas that you guys wish. Also, I'm going to be giving you guys a copy of this report to go home. So if after you go home, you read it over and things don't make sense, shoot me an email. I'll be more than happy to kind of further explain. So just so everybody is on the same page in the room, Minnie was diagnosed with Tourette syndrome in 2018, and that is the main reason for this referral. So, Mom, you expressed concerns that her tics, which are both motor and vocal, may be getting in the way of her accessing instruction. In addition, you mentioned that she has trouble with transitions and she has trouble completing assignments. And also, she has trouble with some compulsions and urges to touch objects or peers with an open palm. And Miss Disney, you just shared that you do see that in the classroom or out on the playground, right, where she touches peers with a palm. So we're going to be addressing some questions in this evaluation. And the first one is, what are her present levels of cognitive, academic, adaptive, and social emotional functioning? We're going to answer if she meets eligibility criteria for a specific learning disability, just SLD, or other health impairment, OHI. And if she is eligible for either one of those or both, we're going to determine, does Minnie require special education services in order to make academic, behavioral, and social progress? So, something that I wanted to point out here in the development and health history is her educationally relevant medical information. So, like I said, Minnie does have the diagnosis of Tourette syndrome. Tourette syndrome commonly co occurs with attention deficit hyperactivity disorder, so ADHD, and obsessive compulsive disorder, so OCD. Some common difficulties that we see in students with TS include challenges with transitioning, difficulty with homework completion, difficulty following directions, some disorganization and executive functioning deficits, disinhibition, so such as touching certain objects. Mom, you mentioned that's something that she does. Some explosive behaviors, impulsivity, oppositional behaviors, problems with perfectionism, some sensory issues, social communication deficits, and stress and anxiety. So that's something that we should all keep in mind. These are all commonly seen with students with TS. It doesn't mean that Minnie has all of them, but she does have some of them, and we're going to talk about those when I talk about her observations. So, going into these observations, given that, Mom, your main concern was her presentation of tics, both those motor and verbal tics, I went ahead and did two observations where I counted those to see how often they were occurring. In the first observation, they were completely absent. So they were absent for 100% of the observation, for which was about 25 minutes long. In the second observation, she did present some tics in the first 5 minutes of that observation. So she had 9 of them. So 9% of the time they were present, 91% of the time, though, they were absent. And Miss Disney, you mentioned that often you don't see her ticking in classroom. So that's good to know, right? Right now, it's not a problem. That's not to say that they can't get worse as she gets older. So it will be something that we can monitor as, she goes throughout the grades. So the first observation that I did was observing her during periods of transition. Mom, you said that transitions are something that she really struggles with. So I wanted to make sure observing her both when she was in the classroom going out to recess, and then when she was out at recess coming back into the classroom, as well as transitioning between subjects. So overall, she had no problems with transition. She, appropriately lined up when it was time to go outside. She appropriately lined up when it was time to come back inside. She did not follow through with some of the directions in the first observation. They were supposed to take out their language arts book and then their whisper phones. She did not take out the whisper phone, even though everybody else in the class did. And then she kind of sat in the chair and she brought her legs up to her chest and she was rocking a little bit. And when Miss Disney asked her to see it sit appropriately, she did, but then she kind of pushed the book to the side and stopped working. In the second observation, this is where we did see those tics. So again, it was in the first 5 minutes. It was during lecture. So Miss Disney, you were lecturing about 9/11 and kind of the history of that. And that was the only time that I seen those motor tics. So she shook her head kind of back and forth. No vocal tics though. After the lecture ended, she was asked to take out a math worksheet and they were supposed to fill this out independently and then ask for their answers to be checked once they finished the sheet. Minnie did finish the worksheet and she worked independently on a second math activity with no problem. Afterwards, the class transitioned to language arts, and again, this was a smooth transition for Minnie, so no issues there. Next are the interviews that I did with both you, Mom, and with Miss Disney. You guys can look over those on your own time. The student interview, I interviewed Minnie prior to conducting my testing and just kind of got to know her a little bit. Her favorite subject is reading and her least favorite subject is math. She told me that she enjoys spending time with her brother. She enjoys drawing and coloring and talking to friends. I asked her when she grows up what she wishes to be, and she said that she wants to be a scientist so that she can be anything she wants to be, or an artist. So she was a really great student to work with. Okay, so now we're going to get into kind of what we actually did here, the bulk of the report. So this is answering the question, what are her present levels of cognitive, academic, adaptive, and social emotional functioning? So first, I'm going to talk about how she was during testing. She was cooperative and appropriate during the entire time. Testing occurred across 3 days. Initially, I do want to mention that when I first met with her, she did display some tics. And I think that was because she was a little unsure about what was going on. But once she became comfortable, there were no tics for the rest of that session or any other sessions that followed. Another thing that I wanted to mention was when she was required to listen to what I was saying, but not actively look at materials or engage with materials, she was very easily distracted. She would get out of her seat, she would play with some pens or pencils, she would draw on the whiteboard, and so that was only when she was not looking, because some of the tests that we do require her to listen only. So when she was listening only, she was very easily distractible. But when she did have some manipulatives to actually engage with, she was very attentive. Also, something I want to mention that is consistent with her TS diagnosis is that she needed to know whether or not she got an item correct. And if I didn't tell her yes or no, she wanted a check mark. So I kind of had Post-its by me and she wanted me to make a little check after each item. And she would not move on until I gave her those checks. So kind of that perfectionism, right? Something I talked about earlier, and that is something that we are seeing in Minnie. In addition, for the items that had complex directions, her ability to sustain attention long enough to hear and understand what she was supposed to do was limited. So a lot of times directions needed to be repeated to her. Okay, so this kind of breaks down the test data and interpretation part. So this talks about what the scores are, what they mean. These are the ranges. And I'm going to give you guys a handout along with the copy of the report that kind of talks more about what scaled scores mean, as well as what percentile rates mean, so that you guys can go back and look at it if you guys have further questions. Okay, so I gave 3 main tests. I gave the Debbie J. Woodcock-Johnson test of cognitive abilities. This was my main core battery that looks at several dimensions according to the CHC theory. So there's also the CTOP. This is a test of phonological processing. I gave the TAPS. This is some more processing, looks at language processing, auditory memory, and some comprehension skills. And then Mom, I gave you the BASC to fill out, and I gave it to Miss Disney as well. And that was the behavioral rating scale. And we'll go over that at the end. So, and that kind of talks about what the scores are for the BASC. Okay, so getting into the main results, her crystallized intelligence, which is kind of her main core, right? That depth and breadth of knowledge and skills that are valued by our culture. This was a 94. This is a strength for her, and it's in the average range. So comparable to her same age peers, she has very well developed skills in this area. Her visual processing was also a strength. It was a 105. This again is in the average range of functioning. This is her ability to solve problems and take in information visually and analyze it. She scored really well on that too. Her processing speed, this was a 74, and it is a weakness for her. However, this was one of those tests where some of those inhibition and those impulsive behaviors came through. She had difficulty staying within the lines. You have to look at several rows of letters and numbers and kind of match on each line, but instead she was making very large slashes on the page, which affected her ability to look at the letters and the numbers and make matches. And that is why I think she is scoring so low. So it's most likely an underrepresentation of what her actual functioning is, but that's kind of where she is. And it happened on both of these tests. Okay. Her fluid reasoning was a 94, so that's a strength. This fluid reasoning is about her ability to solve novel on-the-spot problems that can be done by using previously learned behaviors. So she did really well on that. Her long-term storage and retrieval was a 125, which is huge, right? That's in that high average range. It's a strength for her. This is her ability to store, consolidate, and retrieve information over long periods of time, or so previously learned information, right? And Mom, you said she loves to read. She is really good with her numbers and letters, and that's kind of seen here. Her short-term memory was also a strength. It was a 91. This is the ability to take in short-term information and be able to hold on to it and manipulate it long enough to produce something with it. So this includes her memory span and her working memory skills, which again are a strength for her. Her auditory processing, it's a 112, in that high average range. It's a strength for her. This is her ability to take in auditorily heard information and use it and process it. So this was really good strength for her. Okay, we're going to go into her academic results. So this was not done by me. This was done by our resource teacher, but I'll go over it regardless. So she got a 91 in her basic reading, which is a strength. She got a 101 in her reading comprehension, which again is another strength. She got a 112 in written expression, which is a strength as well. Her math, she did a 101, a strength. Math computation, which is that ability to answer facts pretty quickly and accurately. Math problem solving, so her ability to read and reason math problems, this is a 106, which is also a strength. Okay, so we answered her cognitive skills, her academic. Now we're going to go into her social, emotional, and behavioral functioning. This was that BASC that I gave both you, Miss Disney, and Mom. You guys both filled it out for me, and we're going to kind of compare how she did. So let me go down here. Okay, so Mom will go over your scores first. So 4 of the areas that Minnie scored in the at-risk range based on the answers that you provided were hyperactivity, which is common with students with TS, and it is consistent with the behavioral observations that we did and her testing behaviors, right? At times, she's kind of all over the place. Her aggression, Mom, you mentioned that with her little brother, she can be aggressive. She can not listen. She tends to argue a lot at home. And so that's why that area is elevated. Social skills, Mom mentioned that Minnie has trouble kind of making friends at times or knowing how to approach friends. Again, that social skills communication is something that we do see in students with TS that they can struggle with. So these areas, right, hyperactivity, aggression, social skills, and then activities of daily living, which just means that she might need some help doing some basic everyday tasks. So these are in the at-risk range. They aren't clinically significant, so it doesn't require intensive intervention, but they do require us to kind of follow up. It is something that we want to keep an eye on. Here is your graph kind of showing what I just mentioned. Miss Disney, same kind of thing. We see an at-risk elevation for hyperactivity. We see an at-risk elevation for aggression. And then that's it for there. So that is consistent with what we are seeing both at school and in the home. And there is Miss Disney's graph.